I may become one of your patients, but first I have some questions to ask you about fillers. I just saw an ad about permanent fillers. Do you do permanent fillers?
No. Think about buying a dress when you're 40 and saying, I'm going to wear it the rest of my life. It's not going to fit because your body will change, most likely. It does for most people. And fillers are the same way. You want a filler that will last only for a year or a year and a half because your face changes as well. Skin gets thinner every year. The amount of fat in the face changes. Even the bones change. An example like Juvederm or Juvederm Ultra Plus. These are products that are designed to last 12 to 18 months. They gradually go away so that we can then place the next increment of fillers in perhaps a slightly different location depending on the need.
I was at a spa recently, and there was a friend of mine who was injected with the fillers just by one of the technicians there. Is that all right, or shouldn't it be done by a regular doctor, or how do you feel about this?
Well, in Florida, the law is that only a medical doctor, an MD, a DO, a nurse practitioner, or a physician's assistant, those working under the supervision of a physician, are allowed to inject fillers.
Doctor, what do you feel about the safety of the permanent fillers?
You think of your face, it's not a piece of cloth. If it gets messed up, you can't go buy another one. So you want to have the filler put in by somebody who understands the anatomy of the skin, but also the anatomy of the muscles and other structures in the face, blood vessels and nerves, and also understands how those work.
Don't the other practitioners have that information and know all of that about safety and everything?
No, not necessarily, because that's not necessarily part of their training. Well, the key thing here is safety, because a plastic surgeon knows where to put the fillers to get the best beauty result, but also to be able to take care of any potential problems that might occur. If you think of the filler as kind of like concrete, it's going to be put in this place, this deep dermis, and it will spread out and fill that area. Well, if it gets injected into a blood vessel, it's like putting cement into a PVC pipe. It's going to clog it up. Well, if it does that for a blood vessel, that's a serious problem.
Then what?
Well, the area where the blood normally will go doesn't travel anymore, so that area is deprived of oxygen and nutrients and will get dark and can die. For example, a portion of the lip, or a portion of the nose, or the tip of the nose, or even the eye. So you need to have someone who not only understands the anatomy, but also understands how to treat these kinds of complications, and is able to do so right away. In our practice, we like to have people come back a week or a week and a half later to make sure the filler's where we want it, and to make sure the patient is satisfied. And this should all be part of the cost, which is not going to be any different whether you see a plastic surgeon or someone who's not a plastic surgeon.
So how do I know how to choose a doctor? How do I know if they're qualified to do this?
In the day and age of the internet, you can go to websites like healthgrades.com or drscorecard.com.
Do I choose the one with the lowest price? Is there any difference?
If the person isn't trained as a plastic surgeon who's doing the injecting of fillers, it may be that they are still practicing on you, and if they're practicing and learning on you, that may not be a good thing. That may be why they charge the lowest price out there. Plastic surgery is really the business of art. It was Ralph Waldo Emerson who said that the love of beauty is a matter of taste, but the creation of beauty is art. That's what plastic surgery is about.
Thank you, Dr. Frazier. I really appreciate all your information. You've been extremely helpful.
You're welcome.